Hello and welcome to Let's Talk About, a health podcast series brought to you by Tallaght University Hospital in partnership with the Adelaide Health Foundation. This is our second six-part podcast series, which you can find on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode in the series will be targeted at anyone who wants to learn more about their brain, how they can mind it and how they can keep it healthy. Weighing in at approximately 3 pounds or 1.3 kilograms, the brain is a complex organ that is made up of soft tissue called grey matter and white matter, which contain neurons. Neurons are cells that send and receive information throughout our bodies in the form of electrical and chemical signals. Think of your brain as mission control for how you move, your senses, thought and reasoning, memory and vital functions such as your heart rate and breathing. Like everything else, your brain ages, but as you will learn in this series, there are lots of steps we can all take to help maintain a strong and healthy brain. The most important thing to remember is, it is never too early or too late to look after your brain health. Hello, my name is Paul McElwain. I am a consultant geriatrician at TUH and your podcast host. In this Let's Talk About podcast episode, we're going to talk about the role of assistive technology in brain health and in particular dementia. I'm delighted to be joined by Fiona Tobin, occupational therapist, and Professor Seán Kennelly, consultant geriatrician. Hello.
Hello, Paul.
Hello, Paul.
So Seán, perhaps we'll start with you. We talk about brain health, memory problems, dementia. So what do we mean by these terms?
Brain health is probably a concept that's only been with us for the last number of years, where we've realized that there are factors that we can do that improve the health of our brain overall, which prevents and minimizes or reduces our risk of developing dementia. Probably one of the most common questions I get asked in the clinic is, what's dementia and what's the difference between dementia and Alzheimer's disease? What's the difference between dementia and memory problems? Well, anybody can have memory problems at any stage of life, be it younger or older, and our memory performance fluctuates up and down throughout our life and from day to day and even different times of the day. So it's perfectly normal that we will have fluctuations in our memory performance. In reality, even in the memory clinic, I'm not overly concerned about memory performance. What I'm really concerned about is functioning and our ability to do our day-to-day tasks, because that's where memory nuisance becomes a memory problem. And by memory problem, I mean dementia, which is as a result of having a memory or thinking or communication difficulty, we're not able to do our day-to-day tasks as well as we did them before, which is ultimately the definition of dementia. Now, the most common cause of dementia, which is really just a description rather than a diagnosis in its own right, is Alzheimer's disease. But there are other causes of dementia, such as dementias related to Parkinson's disease, dementias related to stroke, or dementias related to other proteins that can build up in the brain, as we might see in a thing called frontotemporal dementia. So all told, there are about 20 different causes of dementia, but Alzheimer's disease, which is characteristically as a result of these two proteins called amyloid and tau in the brain, is the most common and accounts for about 70% of all cases of dementia over the age of 65 and about half of all cases under the age of 65.
Okay, so Fiona, your position is an occupational therapist, so function is very important. Perhaps you might explain what we mean by activities of daily living.
So activities of daily living are the tasks that we do every day to build up our routine. And people might have heard the terms such as PADLs, which is our personal activity of daily living. And that encompasses us being able to get up in the morning, get ourselves washed and dressed, and then throughout the day to be able to use the bathroom independently, manage our clothing and manage our hygiene needs. And we also have higher level activities, which we would refer to as our instrumental ADLs. And they encompass things like being able to prepare your meals, so make your breakfast, your lunch, your dinner, to plan and sequence your day, and to cover all of your domestic tasks, including managing things like putting out your bins, managing your bills, managing your shopping safely and independently.
Okay, so as Seán has alluded to, when we have dementia, that becomes more it changes from being a nuisance to a problem. And we're going to talk about assistive technology. Perhaps first you might explain what assistive technology means.
Yep, so assistive technology is just a name that we use to describe devices that can support people to live more independently and stay safe at home. So they can be used to meet the needs of people and will work alongside usual care, so it shouldn't replace person-to-person care. They can be things such as electronic pillboxes, which will have a reminder that will tell people when to take their medication. We can have GPS locators for people who are quite mobile and active in the community and perhaps will have a wayfinding difficulty, so it allows family to locate them obviously with consent is an issue with that. You can use locator items, so if people are losing their keys, you can have a device that will help them locate individual items during the day.
Okay, and so Seán, is there evidence to support that these technologies help people with dementia?
Yeah, and exactly as Fiona mentioned, I think the key thing is, depending on the stage or the degree of memory difficulties or functional impairment that you have, you will be using different technologies. So for people who, let's say, are looking at brain health or enhancing what may be mild memory problems, who are looking to enhance their memory performance, well then things like cognitive stimulation exercises, which Fiona can go into a bit more detail on, those are useful. Those are kind of, and whether you use a digital form of those or a pencil paper form of those, they can help. Whereas as people, if you like, progress through the trajectory of living with dementia, they may go from still being mostly independent but needing the prompt to take their medicines and the pillbox alert, to maybe where for some people, as they get to the more advanced stages of living with dementia, where they may be going outside and purposefully walking outside or exit seeking, in which case you may have things like sensors on the doors, GPS trackers which help people be able to locate if they get lost, and those kind of, so different technologies come into play at different stages of dementia. But also it's important to say, depending on your cause of dementia, you may need different technologies at different stages. So if we take something like dementia with Lewy bodies, they may have visual symptoms or they may have visual kind of issues earlier on, or even with some of the atypical Alzheimer's disease that affect our visual centres in our brain, they may need different technologies earlier on than, let's say, somebody with Alzheimer's disease who may have just memory difficulty. So depending on the cause of dementia and depending on the stage of which or where you're at in your lived experience with dementia, you may need it. And from the point of view of evidence, which is the question originally, the evidence is around reducing risk for the individual who's living with dementia, reducing anxiety and enhancing independence for somebody who's supporting the care of somebody with dementia, which is also very important. And the whole focus is enabling people to live within their own homes where they want to live for as long as is absolutely possible. And then there's a whole other piece around, if you like, the cognitive stimulation activities and the evidence base behind them.
Okay. And it's probably important, and you guys will have experience of this from your clinical practice, but I suppose some people are tech phobic or a little bit, unsure about how they would manage these sort of technologies. I don't know, what's your approach? I'll start with you, Fiona, in how to sort of maybe support people to make decisions around using these technologies and giving them confidence that they'll actually be of benefit to their daily living.
Yeah, and I think that's a good question, and absolutely sitting down and actually getting a person's individual perspective on their challenges and their difficulties they're having. So technology is all going to be individual based, and trying to start people off by introducing technologies for the issues that they're identifying. So for example, people who are struggling with reading, perhaps from a visual component, introducing them things like an audio book, or working with them around their smartphone or smart device to change the contrast on the screen or to put words into bold, will just help them embrace the technology, and it's a gateway into other devices that may help. So again, for a lot of people, they might like doing Sudoku or word searches, and absolutely pen and paper, that's great. But if they're having a visual impairment due to dementia, if you can get a larger version of it on a screen, on a touch screen, or if they're having problems with dexterity, they can maintain their leisure activities. And when they see the benefit of that, it can lend itself to bringing in other technologies as things change and progress.
No, absolutely. And I think one of the things we've learned in COVID has been, the ability and the adaptability of people in midlife and later life to actually adapt technologies really as easily as younger people. And, the use of platforms such as Zoom to communicate and things like that were very readily adapted both for healthcare needs and for social engagement needs during COVID. And we're seeing, certainly in the clinical services, a huge carryover for that. Now, coming back to Fiona's original point, none of this should replace the person contact piece. And assistive technology should never be seen as a surrogate. It's a supplement to those pieces. It's an enabler of better person contact as opposed to a replacement for person contact. But certainly the ability for people to take on technology is far less of a challenge than it used to be in discussing these kind of supports.
It sort of leans into a slightly different area, but this idea of training your brain or brain training. I mean, there's variable evidence, but there is some evidence out there that it's supportive. You might expand on what people could do or how they would approach brain training.
The concept is that our brain is a muscle, like any muscle in our body, and that if you work it out, it gets stronger. It's a little reductive to think of it exactly like that. What we know from a lot of cognitive stimulation studies is if I do a memory task and keep doing a memory task, my memory gets better, but it doesn't necessarily spill over into functioning. What we're beginning to see through more sophisticated stimulation programs, this is now mostly around a, if you like, dementia prevention piece rather than there's different focus on cognitive stimulation for people living with dementia and reminiscence therapy, which is slightly different again. But for, let's say, cognitive stimulation to reduce one's risk of developing a memory problem or developing dementia, the more sophisticated neural platforms certainly look like they have a bigger impact than, let's say, more traditional kind of single task things like just doing a memory task, just doing a word search, just doing a crossword, which ultimately just made us much better at those single tasks. So we need to exercise multiple areas of our brain to really get that spillover effect. And really where we see the benefit of cognitive stimulation is when we do it in combination with things like exercise. So as opposed to as an isolated intervention, it has a little degree of impact, but when we do it as part of a program, let's say, which incorporates exercise and diet, that's where we see this amplification of impact. But there is a difference, I suppose, in where we have very definite evidences around cognitive stimulation therapy for people who have been recently diagnosed or who are living with dementia, and things like reminiscence therapy.
The reminiscence therapy is an interesting one. I don't know if you'd like to expand a little bit on what that involves.
Reminiscence therapy is making sure that people are being engaged in their activities, and you're going back to interests and hobbies that they may have had as a child, and you're bringing them back to a safe space from a memory perspective and a communication perspective. And it can be a really good way for families to engage, perhaps grandparents and grandchildren. It takes away the challenge of an individual memory problem and can actually really help break that intergenerational gap. An example, the likes of YouTube on a phone, if a grandparent is talking about a song they used to love and maybe they can't remember the words, it can be looked up there and then, and you can have that instant impact. And again, it just brings people closer, and again, it really enhances well-being. And as I say, it gives a safe space for people to communicate.
Because Seán, you're seeing so many people in your memory clinic. If you had a magic wand, for instance, that could invent some technology that would assist some of your patients, is there something in particular that you would love to have available to you?
Gosh, I mean, I think there's so many different elements. I would be reluctant to name one thing on the basis that actually the pressure points for enabling somebody to live well within their own home, and ultimately all of these technologies and interventions for somebody who's received a diagnosis, is to do just that. So the pressure points are actually so different with the individual, but also their care ecosystem. So if you like, the competencies and knowledge base of the people who are supporting their care, they're so different that to name one thing, actually I think would be very difficult. What we see is it's around having that tailored approach around kind of exactly as Fiona mentioned, ensuring that you get a gateway in that makes somebody have a compliance with taking on these new things, which can be difficult when somebody's living with dementia, and then layer on the different supports as you need to go, depending on what it is the potential or imminent crisis that may jeopardize their ability to remain within their own home. So I don't think there's one panacea. I don't think robots and those kind of things that we've done some of the studies with, that there's anything that's clearly coming through as a definitive catch-all solution in that. I think actually it's far more nuanced.
Okay. We're coming to the end of the podcast. You might just think of a top tip you would advise people to, maybe a way of embracing assistive technology.
I think the first thing is not to be afraid of it, and that it's not this invasive device that's coming into your home. It is part of your everyday life anyway, and we're just using what you're used to using to enhance your well-being and support.
Yeah, very good. And Seán?
Yeah, I would echo that. I think it's openness to these new technologies. I think from a societal and governmental perspective, we need to make them more freely available and more accessible, and there does need to be a piece whereby many times actually families have to fund these things themselves, and we should have a better funding stream from a health service perspective about putting these technologies in place. So I think that's another piece we need to focus on.
Okay, well, thank you so much to our contributors today, Fiona and Seán. The key point is that these technologies are there to enable or help us remain independent, not to restrict it. So I think that message was pretty clear today. So thank you for listening. In the next episode, we will look at our brain health and reducing the risk of stroke.